Welcome to The Explainer. Today, we're going to break down the remarkable lifelong journey of treating cleft lip and palate. It's one of the most common birth conditions out there, and the story of how it's treated is just incredible. It's a story about science, art, and amazing teamwork that literally rebuilds a smile and changes a life. All right, so let's just jump right in. What are we even talking about when we say cleft lip and palate? Let's get right to the heart of it. Okay, take a look at this. This slide really breaks it down for us. Over on the left, you see a normal palate. The roof of the mouth is all one piece, totally closed. Now look to the right. See that gap running right down the middle? That's a cleft palate. It's basically an opening that happens when the two sides of a baby's face and mouth just don't fuse together completely during development. So here's how we're going to tackle this. We're going to follow the entire patient journey. First, we'll get into what a cleft actually is. Then we'll meet the incredible team that has to come together from day one. After that, we'll dive into the amazing first surgeries. And finally, we'll see how that care continues all the way into adulthood. Let's start with the basics. To really get a handle on the treatment, we've got to have a super clear picture of the condition itself. You know, what's really wild is that this all happens incredibly early in a pregnancy. For a whole bunch of reasons, the tissues that are supposed to form the upper lip and the roof of the mouth just don't quite meet in the middle and join up. And that leaves an opening, or what we call a cleft. Now, this is absolutely crucial to understand. This isn't just one thing. A cleft exists on a huge spectrum. It could be something as small as a tiny little notch in the lip, or it could be a complete separation that goes all the way through the lip, the gums, and the entire roof of the mouth. And these pictures, wow, they really drive that point home, don't they? A cleft can be unilateral, meaning on one side, or bilateral, affecting both sides. Just look at the difference between image E, a really minor notch, and image F, which is a complete cleft on both sides. This huge variation is exactly why every single treatment plan has to be totally unique. So you might be wondering, how common is this really? Well, in Caucasian populations, the number is about 1 in every 1,000 births. But what's really interesting is that this number changes a lot depending on ethnicity. The rates are actually higher in Native American and Asian populations, and they're lower in people of African descent. Okay, so now that we know what it is, how do you even begin to treat it? This is where it gets fascinating, because this is not a one-person show, not even close. It takes a whole team of different specialists, right from the very beginning. Yeah, I think this quote from our source material just nails it. Longitudinal, what does that even mean? It means this is a long haul, often from the day a baby is born until they're a young adult. And interdisciplinary, that's just a fancy way of saying it takes a village, a whole marathon run by an entire crew of specialists. And what a village it is! Look at this list. You've got your surgeons, obviously, but you also have speech pathologists helping with language, orthodontists for the teeth, audiologists checking on hearing, and even psychologists there to support the child and the family through what can be a really long and emotional road. Right out of the gate, from the moment they're born, there is a huge challenge, and it's something you might not even think about: feeding. Because of that opening between the mouth and the nose, a baby can't create the suction they need to drink from a normal bottle or breastfeed. So right away, they need specialized bottles and a feeding specialist to make sure they get enough nutrition to grow strong for the surgeries that are coming. So that brings us to the really critical first year of life. This is where the surgical team starts to build the foundation for a lifetime of normal function. We're talking everything from eating and speaking to breathing properly. What's really cool is that the work often starts even before the first cut is made. They sometimes use these pre-surgical devices to gently guide the pieces of the gum and lip closer together. Think of it like prepping the canvas before you paint. It just creates a much better starting point for the surgeon, which leads to a better lip repair, and then that's followed by the palate repair a few months down the line. And this thing right here, this is a perfect example of that pre-surgical step. It's called a nasoalveolar molding device, or NAM for short. It's kind of like a custom-made orthodontic retainer for a baby that gets adjusted every week. It gently nudges the gums closer together and even has this little wire that helps shape the nose. It's a really ingenious way to prep the anatomy for an amazing surgical result. Now, the timing of these first two big surgeries is not random at all. It's incredibly strategic. The lip is repaired first, somewhere around 3 to 6 months old. The goal there is to fix the appearance, of course, but also to reconstruct the muscle that's so important for eating and making facial expressions. Then, between 9 and 12 months, comes the palate repair. And why then? Well, it's because this is right before a child starts to really develop their speech, and you absolutely need a closed palate to make sounds correctly. This is where you really see the artistry of the surgeon. I mean, look at this diagram. This is not just about stitching a gap closed. The surgeon is basically a sculptor. They're using the child's own tissue, rotating and moving it around like intricate puzzle pieces to not only close the cleft, but to recreate all the natural little details of a lip, like the Cupid's bow. It's amazing. Okay, so this slide shows two different, very clever ways to fix the soft palate. They look different, but they have the exact same mission: to rebuild the muscle sling at the back of the mouth. This muscle works like a little valve. When we talk, it snaps shut and closes off the passage to the nose, which forces air out of our mouth so we can make clear sounds. If that valve doesn't work, speech sounds really nasal. So getting this muscle working is just vital. All right, let's move into our final section. Because you might think, okay, first big surgeries are done, we're good, right? Nope, the journey is far from over. In a lot of ways, it's really just getting started, because the treatment plan has to grow and adapt right along with the child. This timeline really lays out the long road ahead. You can see it's a step-by-step process. Around the elementary school years, there's a bone graft for the gums. Then during the teenage years, you're looking at orthodontics and sometimes jaw surgery to get the bite perfect. And then finally, once the face is all done growing, a final nose surgery, a rhinoplasty, is often done to fine-tune the appearance. The timing of this next surgery is everything. It's done right before the permanent canine tooth, that eye tooth, is ready to come down. A surgeon takes a little piece of bone, usually from the hip, and places it into the gap in the gum line. This does two huge things. It creates a solid bridge for that new adult tooth to grow into, and it closes any last little opening between the mouth and the nose. Here's a really interesting long-term effect. That early palate surgery, which is so necessary, can create scar tissue. And that scar tissue can sometimes act like a tether, kind of holding back the upper jaw from growing forward as much as it should. So as the lower jaw grows normally, it can create an underbite. That's why once all the facial growth is done, jaw surgery is often needed to move that upper jaw forward and create a perfectly balanced bite and profile. And after all of that, after all those years and all those specialists, this is what it's all about. This photo just says it all, doesn't it? The goal is a result where the child can eat, speak, and hear, just like anybody else, with a smile that lets their amazing personality shine right through. It's just a testament to years of dedicated, coordinated care. So when we look back at this entire incredible, complex journey, what's the one thing you should walk away with? Well, the surgical skill is undeniably brilliant. It's genius. But the real magic, the real key to success, is the team. It's the coordinated, compassionate, and lifelong support from every single one of those specialists that makes these unbelievable transformations possible.